Hi, welcome to today's Medical Minute. Today we'll be talking about UTIs, or urinary tract infections. What is a UTI? That's an infection in any part of the bladder system, your urinary system. That includes the bladder, the kidneys, the urethra. The urethra is the hole that you urinate out of. Women are at an increased risk for UTIs due to the anatomy of the genital area. Some common symptoms, usually burning with urination. You can have frequency with urination. You feel like sometimes you just gotta go and not a lot comes out. You can have like a cloudy urine or sometimes blood tinged. And there's sometimes an odor. Some women will have pelvic pain during intercourse. That can also be a symptom of a UTI. The most common cause of UTI are bacteria, usually from the GI tract, i.e. poop. So E. coli is the most common bacteria found in UTIs. There can be other ones depending on if a patient had been in a hospital and had a Foley catheter placed, or if they come in contact with some other interesting bacteria. Swimming, if you're swimming in lakes and not very clean water, if you're in hot tubs that aren't sanitized. So there's a few things, places, location, men can develop UTIs. Treatment for UTIs is more than likely antibiotics to get rid of that infection. Make sure you complete the entire dose if your provider does prescribe an antibiotic. Prevention is key. Some of the main things that you can do to prevent as far as women goes: urinating after intercourse. Make sure you wipe front to back when you're urinating. I tell little kids all the time, you don't want your poop at your front door, so front to back. Not wiping this way. Preventing it, you can also drink cranberry juice, not the kind with sugar, and feminine products. Certain feminine odor reducing products can actually be more of an irritant and can increase your risk for UTIs. Make sure you're drinking your water, staying hydrated, flushing out all those toxins from your body. Your kidneys do a really good job of getting rid of all the things that your body don't need anymore. So make sure you're hydrating it so that it can flush it out properly. Some complications with UTIs, you can get them often. So there's some people who get reoccurring UTIs and have to go see a specialist. You can have kidney problems, kidney stones, and sometimes you can lead to more complicated infections that could cause death. So if you're having any of those symptoms that I listed earlier, make sure you go see your provider. They can test your urine, usually in office with a simple dipstick. And then if it shows that there's some extra bacteria that should not be in there, then we can send it to the lab and culture it to get the specific medication that would treat that particular bacteria that you may be colonized with for that UTI. Thank you for watching today's Medical Minute. Watch some of our other videos on bottles, boobs, and feeding tubes.